The Minister of Health and Child Care, Dr Obadiah Moyo, who was chairing a multimodal strategies forum for COVID-19 response held in Harare this Tuesday, says government is seized with preventing, containing and mitigating the pandemic.
The overall goal of our national preparedness and response plan, is to minimize morbidity and mortality, resulting from the COVID-19, and associated adverse socio-economic impact in Zimbabwe. The plan includes prevention, and that is what we will continuously be talking about: prevention, prevention, prevention. And the containment, and then the mitigation strategies.
Health professionals who are part of the pillars in the COVID-19 implementation plan gave on-point explanations on the processes involved in testing, treatment, and contact tracing, among other issues.
We have staffed adequately all our points of entry. We screen all travelers that are coming in and that are exiting, and we use temperature screening. So for those that are incoming, after the temperature screens, they are also tested using the rapid test, and where they are positive, we carry out further investigations using the PCR test.
In terms of testing, what we have done is we have engaged the private sector, but obviously they have to meet the standard of the ministry, whereby we inspect them in terms of biosafety, whether they are meeting the international standards of biosafety, and also whether they have the qualified personnel which can able to handle the testing. So in terms of decentralization, we've also availed the test, the PCR test, that is to provincial level, including, we also included the Victoria Falls and Bedbridge, the entry centers as well.
One of the things that the ministry has done early on is identify hospitals and institutions capable of working as isolation and treatment centers. And I'm glad to note that we've got a sizable number of centers that are at this point ready and have actually been helping with isolation and treatment of cases.
The risk still remains that our returning residents or citizens that have visited these countries are at risk of having the disease. We also have contacts of family members or friends of those that have been, of the returning residents that have been confirmed positive. They are at risk of having the disease. You are aware a healthcare worker who is the first call of contact to the sick person is also at risk of getting the disease, and I'll talk of case in numbers. But also the cross-border truck drivers that we have mentioned, and the general public. Everyone in Zimbabwe is at risk of having the disease.
Meanwhile, as part of the COVID-19 response strategy, the National Institute of Health Research is exploring several possible remedies as the fight to contain the COVID-19 continues. Patience Nyagato, SABC News, Harare.